talk about type 1 versus type 2. Educate my
please.
audience.
So type 1 used to be known as juvenile diabetes. It was thought to be something that was genetic, and it was developed as an adolescent, as a child. I was diagnosed at 21 in college. It wasn't in the family, so it was a complete shock. I actually went on WebMD when I was in school with a lot of the symptoms. I just had major shoulder surgery. So, it was weight loss, urinating all the time, constant thirst. Then it was like blurry vision. And then, so I was looking at all these symptoms, and it was like type 1 diabetes. And so I'm talking to my mother, and she's like, no, there's no way, it's not in the family. And then she called the orthopedic surgeon to ask if it was like, something from the surgery. And he was like, nope. So she said, all right, go to the hospital. So my roommate took me, and I guess I gave the nurse all my symptoms, and she goes, yep, that's type 1. Wow. And she said, so this is 2001, okay, 17 years ago. She said, okay, you got the short straw. So at that point, it was still, well, because at that point, it was thought to be, genetic and also, juvenile. So at 21 and not in the family, it was like, what's happening?
Right.
But we're not there anymore. I mean, in the 17 years I've had it, I have known multiple people that are getting diagnosed at 30, 40, late 20s, 50,
really?
50.
With type 1.
And not in the family. And kids getting diagnosed with it not in the family. So my theory is that there's a lot of people that have these autoantibodies, and something is setting them off.
Okay, wait, you got to back up.
Yep.
Because so for folks, do you know what an autoantibody is?
No,
I didn't think so. Go ahead.
Right.
Tell them what
antibodies.
we're not talking about an antibody for a car or like a body shop thing. It's not an auto antibody.
That we knew.
So
But I just want to be sure.
I'm speaking for our listeners.
Thank you.
Yeah. So we all have antibodies that are good, and they fight things. So this is an autoantibody, so it's like not good.
Yeah.
It's killing the things that are fighting off disease. So there's cells that are killing the good cells. That's basically what happens in a type 1 diabetic. So this autoantibody, which actually my daughter was, she was diagnosed in October, unfortunately. So, but we knew she had the autoantibodies. We had her tested in family history, and they tested her, and she had all 5 autoantibodies that they test for diabetes. So there's a test for these things here. So you can say, okay, yep, she's going to get it. Wow. And so something, like I said, something sets off to make these autoantibodies attack the cells and kill off the insulin-producing cells. So I think that the environmental factors are setting them off. Like
what?
Stress is one thing. Like I had the major shoulder surgery, so it could have been the fact that it had the surgery. My daughter had canker sores, so it was a virus in the canker sores set it off. I've heard of people that have, that just have a cold or flu, but something.
So people can live with the autoantibodies and
not get diagnosed,
not trigger them.
Well, they might not be activated, right?
Yeah.
Right. They may only have 1 or 2 of them.
So let me back up a little further, just for our audience, just in case folks don't understand what this is. So part of our body makes something called insulin, right? And it's fancy in the islets of Langerhans, right? In the pancreas. And insulin is basically a transport molecule. So insulin is designed and has evolved so that it takes a particular chemical, which is glucose, which is sugar, and it transports it into the cells because the cells need energy. Right? And the glucose is the energy.
Right.
So that's what happens. So we all have, this ability to make insulin. Insulin then takes the sugar and puts it into the cell, and it's great, and everybody's happy. But in diabetes, something goes perhaps not wrong, but it's a different IM. Because remember, everything's doing the best it can. So for some reason, in type 1 diabetes, our body says, wait a second, this insulin thing doesn't belong here. And it's completely, am I right? It's just completely befuddled. It doesn't make sense that it does that, but it does that, and it starts killing off the ability to either make the cells themselves or affect the transport molecule. Or how does it actually work?
Well, the islet of Langerhans it kills off it kills them off so they can't produce insulin at all.
That's right.
So in type 2 diabetes, it's more or less what you're talking about, where it kind of messes up with the transport molecule.
Right, like an insulin resistance.
Right. So type 2 diabetics, some, not all, still produce insulin, but it just doesn't work properly.
Right.
Type 1, there's like nothing happening.
That's
it's like,
right.
it's sleeping. And so with some of the research, they're finding out that there's very little activity still, but just not enough to really do anything. It's kind of like a car is just idling, and it's there. But the type 2 is the insulin resistance.
But that is key. What you just said is that the research is showing that there's a little activity, but not enough to do something. So that implies that if the researchers can figure out how to enhance that activity or prevent whatever is stopping that activity, some folks may actually recover from type 1 diabetes.
Right. So that's Dr. Faustman has found that the BCG vaccine is that's a vaccine that was used for tuberculosis and cured it in this country. So she found that with the right dosage, the BCG will kind of kill off the cells that are killing off the insulin-producing cells.
Interesting.
Isn't that interesting?
Yeah, and in a few of her patients already, people that are in the trial, they've found that they've had normalized blood sugars with a few doses and over a long time. It takes a while because you have to have so many years of research. But there was a few people in her trial that actually their normalized blood sugars, some with some insulin. But at the end of the day, the A1C, the normalized A1C, is what's going to prevent the complication. So it's a step towards the cure.
But you brought in another term. So tell them what an A1C is.
So an A1C is your average glucose for over a 3-month period.
Yeah.
So if your sugars, so obviously a normal person's A1C is like below 5.5 at most, but 4.7 or whatever. They want a diabetic, as a type 1, they want you a little bit higher, like 7. Type 2s, they probably want you closer to like the 6.5. So that's what it looks at. And they say, actually, I was at a conference this summer, and they showed us a chart. It said type 1 diabetics, like when your A1C is from 5 to 7, the complications are here. When it goes from 7 to 8, it goes up a little bit, and then over 8, they see the rise in complications. Amputation, blindness, neuropathy. Then our heart failure is the #1 killer with diabetes. So the goal is a normal A1C.
Right.
With insulin, with some insulin, whatever. Without insulin, obviously, would be great. But that's what the ultimate goal is for a diabetic, with their care. Because if it's too low, that means you're having low blood sugar, and too high, obviously, that's the swings are really what's the worst thing.
So let's just recap for a moment. So the symptoms that you experienced 21, they were having to go to the bathroom all the time, being thirsty, losing weight, and then having blurred vision.
Blurred vision, and major fatigue. There was some vomiting after one meal.
And how long did that go on for before you said, whoa?
It was a few weeks.
A few weeks.
It was a few weeks, and I think that once the blurred vision came into play, like there was one night where I was just wicked tired, and then I think the blurred vision started, and then we have the dry mouth and all that stuff, and it was it was probably like 3 weeks, and
right,
and it just presents like that.
And these are the classic symptoms: increased thirst and urination, weight loss, and blurred vision. Those are really and then the fatigue.
Yeah.
Classic symptoms. Unusual to be starting at 21. We certainly know plenty of kids, really young kids, and then in their teens.
Usually, what age is it presenting?
Well, it used to be called juvenile onset diabetes.
Yeah, right.
So you can be really young, 2-3 years old. But
oh wow.
There's been babies diagnosed at like 6 months, and then yeah, and then 12 or 13.
Right.
So my daughter was 5.5.
Yeah.
Yeah, it really depends. So the problem becomes when it's like not in the family. You may have an issue where, you go to the doctor and they don't test the blood because it's not in the family. It's probably the flu. It's probably some kind of virus. And at the end of the day, it takes one finger stick.
That's right.
I have my little meter in my pocket.
Yeah.
I take my meter out and check the blood sugar, and it's like that's it. That's as easy as it is. But again, if it's not in the family, it's still one of those things where no, it can't be diabetes, because it's not in your family. Let's just let's wait a little while, and because they're the flu-like symptoms, fatigue, tired and thirsty,
right.
Rested up.
Non-specific symptoms.
Yeah.
So we're going to come back because we have non-specific symptoms, but we have very specific sponsors, and I want to make sure that we get to our commercial break for our specific sponsors.